The future for experiential learning at ASU will include virtual reality, simulation experience where they can practice communication, clinical judgment, and work in a safe environment. Simulation is practice before they go out into the real life setting.
We have high-fidelity manikins that can blink at them, that can turn their head, that can even give birth, and there's hands-on mannequins that they work with. Equipment, just like they would in the hospital setting, injection needles, IV start kits, and they get to practice with those in a controlled environment.
They're not taking care of live patients, they're taking care of mannequins and standardized participants, which are actors. Understand the communication that goes into taking care of patients in a psychologically safe environment so that they feel confident and more capable whenever they go to the hospital setting or the clinic setting to take care of their patients.
Simulation mannequin is able to provide the technology to parallel similar attributes of a real human. We can recreate any kind of clinical scenario in a controlled environment. So whether that's a pediatric scenario or an older adult, where they can take that experience that they've already had here and carry that into a clinical practice setting.
They're able to practice without feeling any concerns or anxiety about causing any harm or doing something wrong.
I think the future is bright for experiential learning at ASU and Edson College. With the expansion of ASU Health, there's opportunities to move into virtual reality, augmented reality as a component of the student experience. We will always have high fidelity simulation, we will always have some virtual learning and real patient contact. But in the pyramid of learning, it's very important to have all those pieces that come together for safe learning for our students.